here is something most people are never told, especially after the age of 60. And it may surprise you in a calm but powerful way. Microscopic cancer cells are forming inside your body right now. And this is not a possibility or a theory, but a well-documented biological fact. Autopsy studies on people who died from accidents with no cancer diagnosis during life routinely reveal tiny clusters of abnormal cancer cells. Yet most of those microscopic cancers never grow into dangerous tumors, and many remain silent for decades without causing harm. So, the real question is not whether cancer cells appear in the body, because they do, but whether they are allowed to grow. That difference often depends on systems that are already inside you, working quietly without your awareness every single day. And the encouraging part is this: your daily food choices can influence those systems in measurable and meaningful ways. This is not about miracle cures or extreme diets, and it is not about replacing medical care when it is needed. It is about supporting the natural defenses that your body has relied on for your entire life. And those defenses become even more important after the age of 60, when immune strength and inflammation control naturally shift. Before we talk about the 5 specific foods, we need to understand the 3 defense systems that determine whether cancer grows or stays small. Your body has 3 primary biological systems that decide whether microscopic cancers remain harmless or begin to expand. The first system is your immune surveillance network, which includes natural killer cells, T cells, and specialized white blood cells that patrol your tissues constantly. These immune cells identify abnormal cells and destroy them before they can form visible tumors, often thousands of times during your lifetime. Think of it as a quiet security team that checks every hallway and room in your body, removing threats before you ever notice them. The second system involves inflammation control, because inflammation can either heal tissue or create an environment where cancer cells thrive. Short-term inflammation helps you recover from injury or infection, but chronic low-grade inflammation acts like a slow-burning fire inside the body. That fire releases chemical signals that tell cells to grow faster, divide more frequently, and ignore normal stop signals. Cancer cells benefit from that environment, and that is why chronic inflammatory conditions are associated with higher cancer rates. The third system is something many people have never heard about, and it is called angiogenesis, which means the growth of new blood vessels. A tiny cancer cluster cannot grow larger than about 2 millimeters without developing its own blood supply. If it cannot recruit blood vessels, it remains small and often harmless for years or even a lifetime. But if blood vessels begin feeding it, oxygen and nutrients growth can accelerate dramatically. Your body has natural mechanisms that either allow or block that blood vessel growth. And here is where food becomes powerful, because certain compounds in everyday foods help strengthen all 3 systems. Now let us look at the 5 foods that have been studied in real people, not just in theory, and understand how they work. 1. Green tea. Green tea may look simple in your cup, but inside that warm liquid are compounds with well-studied biological effects. The most important compound is called EGCG, a natural plant chemical found in tea leaves that dissolves when brewed correctly. Research shows that EGCG can reduce markers of chronic inflammation, such as C-reactive protein and interleukin-6. In several human studies, those inflammatory markers dropped by 30 to 50% after consistent daily green tea consumption. That level of reduction is significant and comparable to effects often seen with certain medications. Green tea has also been shown to enhance the activity of natural killer cells, which are key players in immune surveillance. In one study involving older adults drinking 3 cups of green tea daily improved natural killer cell function by nearly 50%. That means the immune system became more effective at identifying and removing abnormal cells. Green tea compounds also appear to slow angiogenesis, making it more difficult for microscopic tumors to recruit blood vessels. Large population studies in Japan observed lower rates of colon, stomach, and esophageal cancers among people who drank several cups daily. It is important to prepare green tea properly because extremely hot water can damage beneficial compounds and irritate the throat. Allow boiling water to cool for a few minutes before pouring it over the tea and let it steep for about 5 minutes. 2 to 3 cups daily appears to be the amount used most often in support of research. Matcha powder made from ground, whole tea leaves provides a concentrated source and can be used once daily if preferred. Green tea is not a cure, but as a daily habit, it gently supports all 3 defense systems. And this is only the beginning. 2. Broccoli and broccoli sprouts. Broccoli and other cruciferous vegetables contain a compound called sulforaphane, which has attracted serious scientific attention. Sulforaphane does something unique because instead of acting as an antioxidant itself, it activates your body's own antioxidant defense genes. Specifically, it stimulates a pathway known as NRF2, which turns on protective enzymes inside your cells. This means your body begins producing its own internal protective compounds rather than relying only on what you consume. Sulforaphane has also been shown to enhance immune cell activity, including natural killer cells and T cells. In addition, it appears to interfere with angiogenesis, making it harder for tumors to establish a blood supply. Most people eat only the florets of broccoli, but the stalk actually contains even higher concentrations of sulforaphane precursors. Slicing the stalk thinly and cooking it gently makes it tender and easier to enjoy. Broccoli sprouts, which are very young, 3-day-old plants, contain dramatically higher levels of sulforaphane than mature broccoli. In one controlled study, consuming broccoli sprouts daily led to reductions in cancer-related biomarkers by approximately 60%. That does not mean it prevents cancer on its own, but it shows measurable biological activity in humans. A practical amount used in studies is about 1 cup of chopped broccoli daily, or half a cup of sprouts. You can add sprouts to salads or sandwiches, or lightly steam broccoli as a side dish with meals. Consistency matters far more than perfection, and the next food may surprise you because it is sweet, colorful, and often overlooked. 3. Papaya. Papaya is a tropical fruit with bright orange flesh, and that color signals the presence of protective carotenoids. One specific compound called beta-cryptoxanthin has been associated with lower lung cancer risk in long-term studies. In a large study following tens of thousands of women over many years, higher intake of beta-cryptoxanthin correlated with a significant reduction in lung cancer incidence. Interestingly, that protective association was observed even among individuals who had smoked earlier in life. Beta-cryptoxanthin tends to accumulate in lung tissue after absorption, where it may help reduce inflammation and oxidative stress. It also appears to influence angiogenesis pathways in laboratory research. Some people worry that fruit contains sugar and therefore might feed cancer, but that idea oversimplifies human biology. Whole fruit contains fiber, which slows sugar absorption and prevents rapid insulin spikes compared to refined sugars or juices. The key distinction is between whole fruit and fruit juice because juice removes fiber and concentrates sugar. Eating about 1 cup of fresh papaya daily provides a practical amount similar to what has been examined in research. If blood sugar is a concern, pairing fruit with a handful of nuts or yogurt can further moderate absorption. Papaya is not medicine in a bottle, but it offers nutrients that support anti-inflammatory and immune pathways. And the 4th food may look unusual, yet its deep color tells an important story. 4. Purple potatoes. Purple potatoes contain anthocyanins, the same pigment compounds that give blueberries and red cabbage their color. Anthocyanins are powerful antioxidants with anti-inflammatory and anti-angiogenic properties observed in multiple studies. In laboratory research, extracts from purple potatoes slowed tumor growth more effectively than extracts from white potatoes. One fascinating finding involves cancer stem cells, which are small populations of cells capable of regenerating entire tumors. Traditional treatments often target rapidly dividing cells, but may not fully eliminate these stem-like cells. Certain anthocyanins have demonstrated selective toxicity against cancer stem cells in experimental models. This does not replace treatment, but it highlights how diet can influence biological pathways linked to recurrence. Cooking purple potatoes normally is fine, and roasting, steaming, or baking preserves their beneficial pigments. Allowing cooked potatoes to cool before eating increases resistant starch content, which feeds beneficial gut bacteria. Those bacteria produce short-chain fatty acids that reduce systemic inflammation. A reasonable amount is 1 medium purple potato daily, or several servings per week. Food is not a weapon, but it can be an ally, and the final food works not only directly, but also indirectly through your gut microbiome. 5. Turmeric. Turmeric is a bright golden spice that has been used in traditional cooking for centuries. Yet, modern research continues to uncover its deeper biological effects. The active compound in turmeric is called curcumin, and it has been studied extensively for its anti-inflammatory and anti-angiogenic properties. Chronic inflammation creates an environment where abnormal cells can multiply more easily, and curcumin appears to reduce several inflammatory signaling pathways involved in that process. Laboratory studies suggest that curcumin may interfere with molecules that cancer cells use to communicate and grow, particularly pathways associated with uncontrolled division. Curcumin has also demonstrated the ability to influence angiogenesis by limiting signals that stimulate new blood vessel formation. Some early human studies in individuals with precancerous colon changes showed reduced inflammatory markers after consistent curcumin intake. Turmeric works best when combined with black pepper because a compound in pepper called piperine enhances curcumin absorption significantly. A practical approach is adding half to 1 teaspoon of turmeric powder daily to soups, stews, eggs, or warm milk. Turmeric is not a cure, but as a steady dietary habit, it may help calm the inflammatory fire that fuels many chronic diseases. And reducing that background inflammation is one of the most consistent themes in cancer prevention research. 6. Garlic. Garlic may seem simple, but when crushed or chopped, it releases sulfur-containing compounds with measurable biological activity. One of those compounds, allicin, has been studied for its immune-supporting and anti-inflammatory properties. Population studies have associated higher garlic intake with lower rates of certain digestive cancers, particularly stomach and colorectal cancers. Garlic compounds appear to enhance natural killer cell activity and may stimulate other immune responses involved in tumor surveillance. In addition, garlic has shown the ability in laboratory settings to influence apoptosis, which is the programmed cell death process that removes abnormal cells. Garlic also appears to affect angiogenesis-related signaling pathways in experimental research. To activate its beneficial compounds, garlic should be chopped or crushed and allowed to sit for about 10 minutes before cooking. This resting period allows the enzymatic reactions to form active sulfur molecules. Including 1 to 2 cloves of garlic daily in meals is a reasonable and safe dietary approach for most people. Garlic is not aggressive medicine, but it is a steady immune ally when used consistently. 7. Pomegranate. Pomegranates contain compounds called elagitannins, which are converted by gut bacteria into smaller molecules known as urolithins. These metabolites have been shown to influence inflammation and angiogenesis pathways. In men with rising prostate-specific antigen levels after treatment, daily pomegranate juice was associated with a slower rate of PSA doubling. That suggests a potential slowing of cancer progression, although it does not eliminate existing tumors. Pomegranate compounds also appear to nourish a beneficial gut bacterium called Akkermansia mucinifila. Higher levels of this bacterium have been associated with better immune responses, including responses to certain cancer therapies. Supporting gut health may therefore influence immune strength indirectly. 8 ounces of pure pomegranate juice daily is a commonly studied amount. If the flavor is strong, diluting it with water maintains benefits while improving taste. Whole seeds can also be sprinkled over salads or yogurt. Within weeks, gut microbial balance can begin shifting in measurable ways. And when your gut communicates effectively with your immune system, systemic inflammation often decreases. 8. Blueberries. Blueberries are rich in anthocyanins, the same family of compounds found in purple potatoes, but in a different nutritional matrix. Anthocyanins are known for their antioxidant and anti-inflammatory activity, and they have been studied for their potential role in slowing cellular aging. Chronic oxidative stress can damage DNA over time, and compounds in blueberries may help reduce that stress at the cellular level. Some laboratory studies suggest blueberry extracts can inhibit angiogenesis-related pathways, although more human research is ongoing. Blueberries have also been shown to improve vascular health, which indirectly supports overall tissue oxygenation and immune efficiency. In older adults, blueberry consumption has been associated with improved cognitive function, suggesting benefits beyond cancer-related pathways. About 1 cup of fresh or frozen blueberries several times per week is a practical amount used in dietary studies. Frozen blueberries are often just as nutritious as fresh and can be added easily to yogurt or oatmeal. Deep color in fruits often signals protective phytochemicals, and blueberries are one of the most accessible examples. Supporting cellular resilience is not dramatic, but it is profoundly important over decades. You might begin your morning with 2 cups of properly brewed green tea. Mid-morning, you could enjoy a serving of papaya with a small handful of nuts. At lunch, include broccoli or sprouts alongside your main meal. In the afternoon, another cup of green tea reinforces consistency. Dinner could feature purple potatoes as a colorful side. Before bed, a small glass of diluted pomegranate juice supports overnight gut activity. This structure is flexible, affordable, and built around ordinary grocery store foods. These foods are not substitutes for surgery, chemotherapy, radiation, or physician-directed treatment. If you have cancer or are undergoing therapy, always discuss dietary changes with your healthcare provider. Research suggests these foods may complement conventional treatment, but they are not standalone cures. The power lies in steady daily patterns rather than dramatic short-term changes. Even individuals over 60 and even those with prior diagnoses may benefit from supporting natural defense systems. Fear is understandable, but action provides direction. Each cup of tea, each serving of vegetables, each glass of juice is a small biological signal, and small signals repeated daily can influence long-term health trajectories. Supporting your body does not require exotic ingredients or expensive supplements. It requires consistency, patience, and respect for how your biology actually works. You are not powerless in this process, and while no food guarantees prevention, strengthening your natural defenses is always a wise step. If this information feels useful, consider sharing it with someone who might benefit from understanding these quiet protective systems. Because sometimes the most powerful changes are not dramatic at all, but steady, simple, and repeated every day. And that is where long-term resilience begins.